Hello and welcome to the Age Well podcast. And I am your host, Stacey Donnelly. And this week I'm going to be talking about the architecture of connection. So we're going to be talking about human connectedness. So the title of this episode is From Fragmentation to Union, Addressing the Spiritual Health Crisis. So last episode, I was talking about the physiology of stress. And as a nurse, health coach, and just as a part of the local community, I am making some observations in what I think are issues within health, within our society. So some of these things that I'm going to be talking about may sound a little bit sort of out there, but I do absolutely believe in health as a whole. And when I talk about health, I mean health at every level. So this week I wanted to talk about human connectedness and what that actually means in relation to our health and well-being. So just some of my observations. I don't actually drive. I don't own a driving license. We do have a family car, but I tend to walk most places. I use public transport. So I make a lot of observations. I like to people watch. That's just me. And some of the things that I've observed in behaviours, my own behaviours as well as others in recent years, have sort of led me to believe that we are becoming disconnected as human beings. And just to build a picture of this, maybe just reflect back to when you were last out and about in a public space. Maybe you were walking through a train station or you were stood at a bus stop. Have you ever been out in public spaces and yet felt completely alone? I've spent many years walking within my local community where I live, and I've moved quite a few times. So I've been able to observe different types of communities, and I seem to see this reoccurring image. So what I tend to see are rows of people engrossed in screens, usually wearing headphones. I tend not to see much sort of eye contact. So I'm one of those people who like to make eye contact with other people who I meet and say hello and smile. And I've always done this since a very young age. And I've just noticed increasingly that there seems to be this reluctance. It's not reciprocated. And it just made me a little bit curious as to why this is becoming more commonplace. So we seem to have traded the common courtesy of a smile or a simple hello for this sort of digital buffer. I'm often amazed actually when I see people walking whilst also looking at the phone. I will probably end up walking in front of a car or falling flat on my face. So I'm always amazed at the extent to which people can actually multitask. And I know this might seem like a bit of a generalization, but I do feel like it's become more of a majority in terms of what I'm seeing when I'm out and about. So although we're physically closer than ever, we're actually more insulated. And as a nurse, obviously I was taught a different way of seeing. So in my world, sort of as a nurse, communication isn't just about words. So we're taught a lot about communication and theories around communication in nursing. In fact, I think the first 18 months of my nurse training was spent primarily learning about communication. And this is obviously verbal and non-verbal communication. And it can be observing a patient, for example, and looking for a subtle sign that they might be in pain or distress. It could be looking for signs of deterioration. So it could be a slight dip in oxygen levels, or with therapeutic touch, we might feel that the skin is a little bit cool to touch. So we're really taught in nursing of the subtleties of communication in different ways. In terms of empathy as well, so, empathy is a physical act. And this is, again, where that therapeutic touch comes into play here. So that could be, a gesture of holding somebody's hand when they're distressed. or bathing a patient, helping them with their sort of day-to-day sort of hygienic needs, really. And it can even be the sort of ritualistic dignity afforded to the deceased. So even in death, there is that connection through therapeutic touch and communication. So in nursing, we know that human connection is a science. So nursing is the science, it's a human science, and it's the science of caring. So connectedness isn't just about feeling good, although that is absolutely important. It's also biological. So if we think about this in a scientific way, we are social beings wired for survival. And when I was talking about stress in the last episode, I was talking about some of the hormones that are involved in the stress response. Equally with human connectedness, there is another hormone called oxytocin, and it's often known as the bonding hormone. So it's produced in the hypothalamus and the brain, and it's what fuels the bond between mother and child, for example, but it's also what builds trust between strangers. So it's really interesting that we've got this intrinsic biological function that is also related to human connectedness. So when we connect, oxytocin can lower our cortisol. So remember in the last episode, I was talking about some of the hormones involved in the stress response, and cortisol is one of those hormones. Connectedness and oxytocin release can also ease anxiety, and it can settle the nervous system. In terms of human connectedness and social connectedness, the data is actually quite staggering, okay? So from some of the research and literature that I've been looking at this week in preparation for recording this podcast, there is a survival gap. So there was a meta-analysis, which is a really high-quality form of evidence of over 300,000 people. And the research found a 50% increase in survival for those people with strong social ties. 50%. There's also a longevity key here as well. So there's an 85-year Harvard study of adult development which identified one single factor for a long, happy life, which is social connectedness. And also, unfortunately, there is a huge cost of loneliness. So without social connectedness, our brains potentially might age faster. We can see physiological signs and symptoms such as high blood pressure, chronic inflammation, and a decline in cognitive function. So that's the sort of physiological aspect of social connectedness. But there are also mental, emotional, and spiritual health aspects to this as well. Mother Teresa once said that being unwanted, unloved, uncared for, and forgotten by everybody, I think that is much greater hunger and much greater poverty than the person who has nothing to eat. Now, we know that Mother Teresa spent most of her life serving others in very poor, very deprived communities. But what she's saying here, that actually being unwanted, unloved, and uncared for is a greater hunger. So I thought that was quite thought-provoking in terms of what we're talking about today. In addition to that, here we are in 2026, 6 years on from what was 2020 and the advent of COVID-19. And essentially we're currently living in the wake of a massive social experiment. Okay, if we put the virus to one side, the public health interventions that were in place during that time meant that we were actually socially distanced, weren't we? So we were told to distance ourselves from each other, and some people had to go into isolation as well. But with any health intervention, we need to look at the risk versus the benefits, and we absolutely need to learn lessons from some of the decisions that were taken as to whether they were actually of benefit or not. And since COVID-19, and again, we blame things on COVID. Okay, the virus isn't at fault here. You know, it's not, and it's not about fault, but it's actually, I'm talking about the decisions that were taken in terms of public health measures. And since those measures were put in place, anxiety here in the UK, so the symptom of anxiety, the condition of anxiety has surged. Okay, so we're seeing a rise in the condition, for example, of agoraphobia. So agoraphobia affects people to the point where they're afraid to even leave their homes. And we've seen a significant increase in agoraphobia type symptoms. Between 1% and 2% of people here in the UK will suffer from severe agoraphobia. But around about 1 in 7 people will suffer even from milder symptoms of agoraphobia and anxiety, and this has worsened since 2020. But even prior to 2020, so between 2013 and 2018, which coincidentally was the era of the smartphone explosion, anxiety diagnoses were already on a sharp climb. So we've had this real sharp sort of spike in technology use. And I'm not saying that technology is at fault here either, but we need to recognize that the way that we're living now is so far removed from where we were even 20 years ago. Okay, so I've got the benefit of hindsight. I'm 51 years old now, so I can remember sort of pre-2000. And I can see the exponential rise in use of technology and the push towards using technology to socially connect. Now, this is just my opinion, but I don't see social media as being wholly social, okay? I do think it has its benefits in being able to keep in touch. I've got family who live, in Canada and in different parts of the UK. It's useful to be able to contact people and stay in touch. It's not a replacement for in-person social connection. There's a lot to be gained from being in person and being socially connected to other people. So I just thought the data around mental disorders, especially anxiety and agoraphobia, were quite interesting when we're talking about social connectedness. So to understand this further, we must distinguish between 3 states. So isolation is a measure that can sometimes be seen as punitive, but it's also sometimes protective. So in nursing, we may isolate an individual for their own protection if they are immunosuppressed, for example, or if there is a communicable disease that can be spread to others. Okay, so it can either be punitive or it can be protective. Solitude's quite interesting. So solitude is actually a choice. So it's the peace of being alone. So solitude, this can actually be time taken for spiritual reflection or just taking time out to be alone in nature, for example. But the main difference here is that solitude and being in solitude is a choice. Whereas loneliness is a disconnect. So it's a hunger for relationships that aren't really being met. And because of that disconnect, you can actually be in a room full of people and still feel lonely. So it's just to make the distinction between those 3 aspects of what I'm talking about here in terms of human connectedness. Personally, reflecting back over the last 5 or 6 years, what I'm observing and what I'm witnessing, I do believe that we are in a spiritual crisis. And I will do a separate episode on spiritual health specifically. So when we think about health is a whole. And as I've said already, that incorporates the physical, mental, emotional, spiritual, and the metaphysical. So when we're disconnected from each other, our spirits begin to fragment, and then we see the side effects manifesting in our physical bodies. So through disconnectedness, we can start to experience physical symptoms, because because we are disconnected. And physically, this can manifest in different ways. So there are links between loneliness, and this is replicated again and again in the research and the literature. Social isolation, can lead to symptoms of high blood pressure. It can affect your immune health as well. It can affect cardiovascular health. It can make you more likely to experience poor mental health, and it can actually be linked to suicide as well. So loneliness is a huge issue in terms of health. And, here in Scotland, it has been recognised, and the government have put some provisions in place to try and combat loneliness and social isolation. And when we think about the population groups, those who live in more deprived areas and people who are disabled are the most affected. Concerningly, young people are actually stating that they're feeling lonely as well. So the 16 to 24 year age group was a surprising find when I was looking at the statistics, and those over 75 years and over as well. So there are many parts of our community where people are living in social isolation and are disconnected from their community. So how do we move from this division back to union? How do we rebuild a community that feels broken? So the irony is that the journey back to others begins with the journey towards self. So we spend so much time focusing on the external that we forget to journey within. So for me, yoga is a holistic practice. So I have recently reconnected with my yoga practice. So yoga is something that I have done, a varying frequency over the years. And I've sort of made this recommitment to my yoga practice because I see it as a really holistic practice that bridges mind, body, and spirit. But for you, this could be art, it could be listening to music, playing music, it could be immersing yourself in nature or being in service to others. So how you connect to yourself will be different for everybody. But what I would like to challenge you today to start with is unconditional acceptance. So just taking a little bit of time each day, even just 1 minute, to sit in silence and just notice your body and your breath. So this is a nice little activity that you can do without any judgment. So sitting and being with yourself with unconditional acceptance, just observing how the body is feeling, on a physical, mental and emotional level. And to do this, it's called body scan, or sometimes it's called body weathering as well. So you can do this exercise either standing, sitting or lying down. And what you do is that you literally start from the top of your head and you scan the body slice by slice from the top of your head all the way down to your toes, okay? And just taking your time in doing this, try not to rush this process, but just notice without any judgment how you feel, okay? So how the physical body is feeling. And then once you scan through the physical body, then you can maybe start to notice your breathing. So focusing on the in-breath and the out-breath, again, without any judgment. And then maybe just tapping in and thinking, how am I feeling? How am I feeling mentally today? How much energy do I feel like I have today? How are my emotions feeling at this moment? And again, just noticing, not trying to change it in any way, and just taking note. So when we respect our own body, mind and spirit, we then become more capable of respecting the person sitting across from us on the train. And then we might drop the headphones, we might make eye contact, and remember that we are an inherent part of nature and of each other. So, human connectedness, something for us to think about. I think it's a bit of a pressing priority as well, certainly. But I want to hear from you. I want to hear what your experience is of human connectedness. How do we rebuild our communities from the ground up? Let's start the conversation. So until next time, stay connected to yourself and each other, and I will see you in the next episode.